everybody, my name is Jackie. I'm an employee at ReNu Medicine in North Aurora. So it is Hair Loss Awareness Month. It is the month of August, and we wanted to talk a little bit about hair loss and why it may happen and hair restoration techniques. So if you take a look at my hairline, I am exhibiting a little bit of minor hair loss around the hairline here in the center, and you follow it along, and I'm starting just to have a little bit of thinning, and the density is lower than it used to be. So I would say in the last 3 to 5 years, I noticed that it started to thin. And that would make sense because I am in my late 30s. And so what happens is as you age, your hormones begin to drop, especially for women in your late 30s and early 40s. And you start to enter what's called perimenopause. Your hormones are not producing as high as they used to. So there may be a drop in progesterone or estrogen. And so you could get a blood test to find out if it is low and if you need to do some microdosing with hormone replacement therapy. But for me, I know that I could possibly do some preventative measures because I am starting to have some hair thinning and hair loss. So one of those preventative treatments that we could do is a microneedle. So that is non-invasive, non-surgical, no downtime. It's done in office. You can use PRP or PRF, which is actually taken from your own blood. And then it's gently injected into the top layer of the skin to encourage new hair growth and bring some blood flow to the area. And so that one's a really good option for me because I don't have major hair loss, I have minor hair loss. And this would be a good way to encourage some new growth and maybe even help stop it in its tracks. And then there's another option that's the Meso gun injection. So I do have another video talking a little bit about it. And so the Meso gun injection is an injection gun, and it takes a small needle just like Microneedle does, and it just goes slightly deeper than the Microneedle would go. And it's injecting the same, whether it's PRP or PRF, and what it is doing is it is encouraging new hair growth, bringing blood flow to the area, and it is actually diving deeper, and so it's really delivering a lot of nutrients down to the follicle of the hair. And so when we do our AI analysis, we can actually see when we use our machine those hair follicles, and it's really cool because it kind of highlights them, and so we can see, are the hair follicles still there? Are they still alive? Are they not there? How much space is in between each follicle? So, if you're starting to exhibit some hair loss and there's really big gaps between each follicle, we know how severe the hair loss could be. So when you would come in and see us, we would do that consultation, we would do an analysis of the scalp line, and we would see what it is that would really suit you and benefit you. And then we do treatments, and we kind of follow along to see how the treatment is going. How is it progressing? Are you showing some good signs? Are you not showing good signs? And do we need to increase or decrease, et cetera, et cetera? And so with those two methods, they are considered either minimally invasive or non-invasive. So they're really good options for people who aren't really ready to take a deep dive into surgical procedures for hair restoration. These are non-surgical or minimally invasive procedures. And so we're really lucky that we do have those options at ReNu Medicine. And like I said before, hair loss can happen because of hormone changes, but it can happen for countless other reasons too. It could be stress. It could be that maybe you're pre or post having a baby. It could be multiple reasons. For a male, it would be testosterone. If his testosterone starts to lower, he might be exhibiting hair loss with other symptoms. And so it is really good to get what's called a baseline blood testing done to kind of see where your hormones may be at. There are other things too that may contribute to hair loss, and whether this is true or not, I do believe that for me personally, I have worn baseball caps my whole life. And so everybody in my family has really full, thick hair, and nobody's really losing any hair either. So for me, I know that I wear baseball caps regularly. And I do think that they did contribute somewhat to some of my hair loss. Seeing that there's some people in my family who don't wear baseball caps at all, and they still have very, very thick, beautiful hair, and they may be in their 50s, 60s, or 70s. And I'm in my late 30s. I'm starting to show some hair loss. So at ReNu Medicine, we do offer those services. We do offer testing, we do our analysis, and it's a really great way to just kind of be proactive about hair loss and try to restore some of um, that scalp line to really get that hair to want to grow, to start growing, and to be thicker and fuller. Have a great day. Thank you. And it is Hair Loss Awareness Month.